I'm Alfred Beauvais, and I'm here with Dr. Deepak Bhatt, who has been involved with the Champion trial that was presented here at the European Society of Cardiology. Deepak, welcome, and tell us a little bit about Champion.
Sure. Well, Champion Phoenix was actually presented as a late breaker at ACC. I'd presented that there. What was presented here was a per-patient level meta-analysis of the 3 prior Champion trials. Professor Christian Ham presented it as a late breaker, and these were 3 trials of Cangrelor versus clopidogrel given in different ways. And Champion Phoenix, back at ACC, had shown that Cangrelor was superior to clopidogrel when given in the cath lab for reducing ischemic events, largely ischemic events in the cath lab. And what was shown in this per-patient meta-analysis was really a confirmation of that finding, but in 25,000 patients where there was a significant reduction with the intravenous antiplatelet agent Cangrelor, a short-acting ADP receptor antagonist, versus clopidogrel, significant reduction in the composite endpoint of cardiovascular death, myocardial infarction, ischemia-driven revascularization, and stent thrombosis, and as a standalone endpoint, a very significant reduction in stent thrombosis.
Right, so when I looked at the data, the incidence of all of these things is very low. And even though there are significant reductions in significant hazard ratios, these are very, very low incidence findings. So let me ask you what your sense of is the clinical impact or the clinical value of these observations with this very low incidence in both groups.
Sure, so I should first point out that this drug is investigational in the United States, but if approved, in addition to the superiority we saw, they're just convenience factors. This is a fast onset, fast offset, intravenous potent agent, so it doesn't have the limitations or liabilities of an oral antiplatelet that once you give it in the emergency department, stays in your system, including maybe when you go on to cabbage. So that's really a practical advantage. Likewise, if somebody can't absorb medications because they're nauseated, or they've come in cardiogenic shock, or they're intubated, a short-acting potent intravenous agent, again, it's practical advantages that it may offer.
Okay, well that's very good, and I think we'll see more about Cangrelor as we move along as an alternative to the oral antiplatelet agents. So thanks again for the information.
Absolutely.